Good afternoon. I am pleased to have you join us today for the kickoff to our five-part Reopen Strong webinar series hosted by Digital Promises League of Innovative Schools. Many school districts are preparing for in-person instruction 5 days a week, a return to the normal school day. However, many safety protocols are still in place to account for how COVID-19 and the spreading Delta variant are impacting their regions. District leaders from the League's Digital Promises League of Innovative Schools will discuss their district's approach to reopening strong for the upcoming year and offer some guidance and some tidbits on how to address these common challenges. I am Dwayne McClary, Director of the League of Innovative Schools. And just a little bit about the League of Innovative Schools. We are Digital Promises flagship initiative. And over the past 10 years, we have grown into a robust and dynamic network of 114 public school districts in 34 states, representing a little over 3.5 million students. League members are committed to working together to improve the student outcomes and solving the challenges facing K-12 schools through innovative strategies, learning technologies, and research. Before we begin, I want to share an outline and a few housekeeping rules. All attendees, you are muted and do not have talking capabilities. Please make sure that you input all questions for the panelists in the QA option below on the Zoom toolbar. If you see or hear something that you agree with, please feel free to show your support and add your comments in the chat section. For the first 35 minutes, I will moderate a discussion with our panelists. And for the last 25 minutes, we will shift to a town hall Q&A. And we invite you, our audience, to drop your questions in the Q&A option below. So we're now going to get started. I'm super excited and so happy to welcome our League of Innovative School panelists, Mr. Dan Gould, who is the Chief Academic Officer for Broward County Public Schools in Florida, Dr. Suzanne Lacy, who is the Superintendent of Talladega County Schools in Alabama, Dr. David Miyashiro, he is the Superintendent of Calhoun Valley Unified School District in California, and last but not least, Mr. Eric Tucker. He's the co-founder and executive director of Brooklyn Lab Charter Schools. Welcome, welcome, welcome.
Good afternoon, Dwayne. Good afternoon, League colleagues. It's wonderful to be with all of you today.
Yes, so excited for you to be here with us. So let's jump right in. Let's dive right in. I want each of you to paint a picture of your district's demographics, including the size, number of students, et cetera, and urbanacity. We'll begin with you, David.
Thank you, Dwayne. We are in San Diego, California. We have 27 schools, about 17,000 students, pre-K through 8 until last year. We opened our first high school this year. So we welcomed our first freshman and sophomore class. We have the largest Middle Eastern refugee population in the country. Some of our students we're trying to get back from Afghanistan. That may come up later. And a beautifully diverse community with 42 plus languages and an amazing community.
Thank you. Eric, tell us a little bit about where you're from.
Brooklyn Lab is a network of 2 middle schools and 2 high schools with a total enrollment of around 915 students, located in downtown Brooklyn.
Awesome. Suzanne?
Well, good afternoon and greetings from Alabama. Talladega County Schools is located in the central part of our state. We're about an hour from Birmingham, Alabama, which would be one of the largest cities in our state. Our school district would be characterized as rural. We have 17 schools from north to south. It's about a 60-mile radius. So we serve 7 communities throughout our school district. Currently, we have been in school since August the 11th, and we have around 7,000 students. And just looking forward to a great year, and glad to be with everyone this afternoon to learn more from you and your school district.
Thank you. And last but not least, Mr. Dan Gould.
So thank you all. So Broward County Public Schools is a county-wide system. So we're fairly large. We're the 6th largest district in the country. About 260,000 students. About 210 are currently in the traditional public school system, The other 50 are spread across 90 public charter schools. And we are classified as a urban district, but from a Northeast perspective, we're really a mix of 31 municipalities, of which some are the traditional urban with tall buildings and lots of public housing projects, and others would be more classified as near urban suburban communities. So it's one school district across the 31 municipalities. So we've got 225 public schools within the traditional public school system, plus the charters. In terms of poverty, we're running at about 60% qualifying for free and reduced meals, and about 60% qualify as non-white.
Thank you. Thank you. Thank you guys for painting that picture for folks to understand where you are, where you're coming from, and your demographics. So let's dive right into questioning. First question is, how are each of you dealing with the federal, state, and local jurisdictional differences in politics pertaining to vaccinations, masks, and in-person and versus hybrid learning? So I know a lot of you are dealing with that. So we're just gonna go ahead and tackle that up front, because I know that's gonna be a lot of what you're dealing with. So who wants to start first?
I'll start, but I'm excited to hear about Alabama and Florida and what's happened over there, because very different from the left coast in California. But our state, when we first went into lockdown, they didn't have any guidance in place. So it was very easy to create protocols and procedures and safety guidelines because there were none. So we brought our team together and figured it out. In May of 2020, we had a reopening of schools summit. We opened for free childcare. And by summer of 2020, we had all of our schools open with kids in them with our own created safety guidance and protocols. But as California has imposed mandates, restrictions, and made quarantining so complicated, it's harder now than it was in 2020. And I'm jealous of some of the leniency and local decision-making that happens on the East Coast, but I'm also sure that that comes with some politicking, and I'm interested to hear about it. So I'll hand off.
I'll go next. In Alabama, we hear a lot that it's a local decision. And I certainly believe in local decision-making, but at the moment, it's quite difficult. Back in March of 2020, our governor closed pretty much our entire state down, including our school districts. We never returned back to in-person learning during that school year. And during that time, we had many state mandates as far as masking, limited capacities at events and things of that magnitude. So in July of 2021, I think the very last order was lifted, and the masking order had been lifted prior to that. So pretty much in Alabama, it's just no mandates whatsoever. We are guided by the Alabama Department of Public Health guidelines, and also the CDC guidelines as suggested guidelines. But like you, David, we've had to just figure some of this out on our own. Having been back in school since August the 11th, we are definitely trying to do everything to provide a sense of normalcy for our students and get back to normal, because we were on a hybrid schedule last year until March. In March, about mid-March, we came back together as one school family and finished the year as one. And of course, in our state, things were really looking up. Cases were low, and throughout the summer, things were looking great. And then right about the start of school, just boom. Cases have been elevated quickly and furiously, not only throughout our state. We are experiencing some of that in our school district, monitoring that very carefully. And really just, again, trying to provide this sense of normalcy with challenges already. And our state, of course, would be next to Mississippi, I believe, in the lowest number of individuals that are vaccinated. They're readily available in our state, but there's still many people that are not considering that as a mitigation strategy. So that definitely impacts not only our entire state, but certainly every school district across the state of Alabama.
Great. Yeah.
So I'll come a little bit further east from our Alabama friends into the state of Florida. And I'll say that here in Broward County, which is between Miami and West Palm Beach, so we're on the southeast side, the three districts together make up over a third of the student enrollment overall. On the vaccine front, we are clearly strongly encouraging it and pushing everything we can, particularly for our employees, to get vaccinated, and have found generally a very positive reception on that front, but it is not mandated. So while we are strongly encouraging vaccines, we have not mandated them. The real issue here for us and across the state of Florida is on the question of masks. We were told, and we were the last district to return to face-to-face instruction last October, and families did choose whether or not to receive remote instruction or face-to-face or stay labeled brick and mortar instruction from October through the end of last school year. Only about half our students chose to come to brick and mortar instruction. But the option for remote instruction was removed from us for this year. So 100% of our students are back, and we started 1 week ago today. The state also imposed, through a special emergency rule, a ban on face mask requirements. So no mandates were to be allowed. Our school board and one other county, Alachua, did impose a mask mandate. And there is currently an escalating bureaucratic war, including litigation, around whether or not we are going to be allowed to continue. We have, here in Broward, implemented a mask mandate. We have had minimal, and by that I mean single-digit incidents of students refusing to wear masks, parents being refused to be allowed into a building because of masks. And when you add our student population and employees, you're talking 300,000 people. But it continues to escalate. At our school board meetings yesterday, a number of very vocal and vociferous people brought in the accusations that we are politically charged or punishing or poisoning children. And a new front has opened beyond masks, which is about testing. And the misinformation that has been provided via social media about tests that have been sterilized using a standard medical procedure called ethylene oxide has reemerged as something that we are giving our children cancer through the use of COVID tests, which are actually given by the county health department. So these three levels, Dwayne, to your question of vaccine, masks, and testing, are a small part of the overall environment, but they are drawing a far disproportionate amount of attention from leadership and, in particular, media, traditional media news coverage, and certainly social media debate. I grow increasingly concerned about the degree of toxicity around these questions. And just this morning, we had the first incident cross the line between rhetoric to physical contact, where a parent who was demanding that students not wear masks refused to stop recording a student and was charged with assault for grabbing a student's arm. And when the public protesters make contact with the students, it has compromised our educational environment. And I encourage all of you, and we'll get into this more, to make sure you have the protocols in place to be prepared to respond to these questions.
Wow. Eric?
So I think we're, in some ways heading towards like two systems of education in America when it comes to kind of safe reopening of schools. There are communities that have high vaccination rates on the background, and there back to school, particularly with masks in place, can happen safely, can happen in a way that safeguards health and well-being, and allows educators to focus on social emotional well-being, to focus on kind of recovery of learning. If you look at a federal level at what we've been asked to do as school systems under ESSER funding, there's priorities around safely reopening schools for in-person learning, around addressing student attendance, engagement and transitions, around closing COVID learning gaps and addressing unfinished learning, around keeping students on path to post-secondary and career readiness, and supporting young people's physical and mental health. I would posit that none of those things are possible consistently, sustainably, without a strong vaccine or a strong kind of a high level of vaccination in the background. So without addressing uneven vaccination head on and advancing equitable vaccination. I'd also argue that kind of a strong masking policy and a culture of masking in classrooms at schools is a critical tool to ensuring that everything else that we want to do as educators, everything else that as parents we want for our own children and we want for other families that are kind of exhausted by this last 18 months and hoping that school can provide something different this year. I worry that in large parts of the country that are highly vaccinated, there's exhaustion around talking about the pandemic and how much of an impact it's had. At Brooklyn Lab, we've lost dozens and dozens of extended family members, of members of our school community to the pandemic. And while we kind of grieve that loss, we also seek to honor the lives of our scholars and staff members, parents and grandparents and aunts and uncles by ensuring that we take the steps necessary to safeguard the health of the wider school community. Because ultimately, health and safety protocols aren't just about staff and about young people attending school. It's about the kind of wider extended family of medically fragile and immune system compromised family members. As educators at Brooklyn Lab who have supported young people through the loss of primary caretakers, who have supported educators through the loss of loved ones, it's going to be hard for us to come together and achieve what we're committed to for all members of our school, for our young people, and to support educators in the way they deserve to be supported in a world where we don't take very seriously the health and well-being of the wider school community. At Brooklyn Lab, we've sought to do that by having an all-staff mandate around vaccination, first strongly encouraging and then moving towards a mandate. We're strongly encouraging scholars and family members, to be vaccinated. And I'd urge us today to talk about the CDC guidance around proper protection being in place and the differences, in terms of how disruptive quarantines are when proper protections aren't in place for safe learning, and how much stability is possible when particularly masking is put in place.
Yeah. Wow. Like all of you have different protocols and dealing with different issues in your states with your jurisdiction areas and your state regulations. So let's talk a little bit about, with all of that in mind that each of you talked about, walk me through how you are preparing for the safest possible return. And I know some of you have already started. So what were the processes that you went through to ensure that these schools were safe to reopen and ready to open? Because I know you're battling, legislation, you're battling masking, but you also are battling this 6 foot versus 3 foot distance. Like, how are you doing that? And David, I'm gonna start with you because I think, you've already started and you've been in school during the pandemic. How are you doing it? How do you ensure your schools are safe?
Thanks, Dwayne. Yeah, in April of 2020, about 3 weeks into the pandemic, we were having weekly Zoom meetings with our parents and families. And distance learning was fine. We've been one-to-one for 7 years. And when they realized the pandemic was not going to go away anytime soon, then desperation on our parents' faces in our weekly town hall meetings became palpable and tearful. And they started to raise concerns about, we both have to work, who's going to help with distance learning, and one of us is going to have to quit our job. And other families in low-income areas, kids are just being left at home by themselves, unsupervised, as parents went to work. And because our labor unions, we have such great relationships, when they started to see our children and families struggling, they came together and said, we need to bring the kids back to school. And so we went to Trader Joe's. That was one of our local grocery stores that was open. And we just took their protocols of distancing and floor markings and plexiglass and applied them to schools. In the early days, masks weren't a thing yet. I think they said, don't wear masks, right? I think early. So we didn't do that initially. And then local nurses and pediatricians helped us with our procedures and safety protocols in classrooms with cleaning and sanitizing. And then as the mask mandates came and distancing became a school guidance for the nation, we implemented all of them. We haven't had one student-to-student case of transmission in 16 months of being open since April of 2020. And through the entire 2021 school year, we're open at scale, all classrooms, every kid, every day. And that's why the mandates now are frustrating, because why are you imposing these things on us when we're proving we can do it safely? And right now it's just masking in the classrooms, but they're forcing us to quarantine without any much reason or common sense. But yeah, we've been very successful and we're excited about this year.
Thank you, David. Wow. Wow. Suzanne, how are you making sure your kids are safe? Because I think you're already back in session. How did you ensure that your schools were safe?
Yes, our students returned on August the 11th, and much like David, we had many protocols in place from last year, of course, on a hybrid schedule that was very in tune to social distancing. So we, had kids in rotations and groups, and then those groups were there every other Wednesday. So Monday, Tuesday, every other Wednesday, Thursday, Friday, then every other Wednesday. So the social distancing aspect was readily achieved last year. This year, with all students back, that has been a real challenge, and we cannot social distance in every classroom and every, situation. Our schools have done a super job of just creating schedules that are more conducive to lower numbers of students, for example, in our lunchroom. Several of our schools have additional classrooms that are open. They've made small cafes in those classrooms for lunchrooms at the elementary level. So kids are also eating in their classrooms. So, simple things like that. As far as lunch is concerned, where ordinarily large groups of kids would be in one space. Again, physical education, redesigning those classrooms and what's happening there to, reduce the number of students in the gymnasium. Of course, class changes, static groups changing at one time versus the entire student population changing when the bell rings for high school students. So, those are small mitigation strategies, but they are strategies that we know are effective. Currently, we are highly recommending masks. That is subject to change as conditions change. And, we are seeing some upticks in certain communities throughout our district. So that has been the common trend across the state of Alabama with masking. Many districts have started out with highly recommending masks and now are moving toward recommending or requiring masks for certain periods of time, like 3 to 4 weeks. Assess the data. And I think, Dwayne, that's the key right there. Opening safely, you have to look at the data, you have to look at the number of positive cases, you have to monitor your attendances, the close quarantines, all of that data is so important in decision making. And, we are working to establish an even more proficient manner of doing that. We're trying to get attendance data right now stabilized. In all of this, our state transitioned to a new student management system called PowerSchool, which some of you may already be using that. It's really a very intelligent system and shows great promise, but the kinks aren't worked out. So when your kinks aren't worked out, then you have to spend time with that. And that has slowed us down a little bit in collection of data, but this week has been much better. And I think we're seeing some of those ironed out.
Yeah.
But I think data is key. You've got to monitor the numbers and definitely communicate with that. We have 2 goals in Talladega County, and that's customer service and communication. We certainly want to, provide a quality education and working very desperately to do that. But at the same time, we really have to prioritize communication and customer service because there's still many fears in our state and our school communities with COVID. And we're doing a lot of social and emotional learning, and not only within the schools, but really supporting our parents with, spending time with them and answering questions and reassuring them, I think would be the most appropriate word at this point, with school starting early here in our state for really all districts statewide in Alabama.
Yeah. Dan, how are you making sure your
So
school?
what I'll say in response to your question is, given all the kind of big picture and top level concerns, what we then did was flip to the discussion. We have an imaginary student named Malik, and we went through Malik's day. From when Malik leaves home and doing, am I feeling okay, temperature checking, to how's Malik getting to school, whether it's in the parent or the school bus. How's Malik entering the school day? Do we have the right mitigation strategies at our single points of entry? What's Malik doing before school activities, in the breakfast, in the hallways waiting, getting to the classroom? We needed to make those routine so that we can focus on teaching and learning, whether it's social, emotional, or core academics. And then working through the logistical concerns about bathrooms. In elementary schools, it's different than in middle and high. What are we doing about lunch, which is very clearly the largest hole in our mitigation strategies? Kids can't eat lunch wearing a mask. And so how are we able to take our cafetoriums that are very small in some sites and extend them inside, outside? What do we do about inclement weather? But we've got to acknowledge that that's a hole. And then the reverse, right? The PEs, and then working out and making sure kids get maskless breaks in the recess and PE sessions. The next piece is we're communicating with Malik's parents. How are we keeping Malik's family informed of what's going on? And then dealing with the known unknowns of adaptions and exceptions, the immunocompromised, the special education and ESE students, and providing them with services. And then what are we going to do with our quarantine students? We have over 2,500 quarantine students now. We're actually at a lower percentage than many of our partner districts here in Florida who have 5,000 to 6,000 kids under quarantine conditions. Those are periods of being out of school for 8 to 10 days. How are we maintaining instructional continuity? But going back to the vision of what's Malik's day and how are we making sure we're supporting Malik? So take all this top down, all these rules and constraints and adult problems, and then navigate them as Malik.
Yeah, that's very important. Like seeing your policies and procedures in action. Like that's very important. Eric, how are you guys doing it? Making sure schools are safe.
Yeah. Our school doors closed March 13th, 2020, and we reopened on August 18th of 2020, 5 days a week in person, and have been open kind of straight through since. We've learned a lot from Broward County. We've learned a lot from Cajon Valley and other peers. I want to echo what I heard from Suzanne and from Dan about the importance of communication and the importance of kind of customer service. I would frame it in terms of the technical pieces of what districts need to accomplish and the adaptive pieces of what we need to accomplish. There's a lot of technical work from an adaptive perspective, from health and safety protocols. We need to make sure that mask mandates or hand washing or kind of visitor restrictions or training protocols are in place. From facilities readiness and cohort development, we need to make sure that people are clear about social distancing and cohorting expectations, about kind of when you break firewalls from contact tracing ecosystems or when you don't, about assumptions of kind of whether transmission occurs for vaccinated individuals or for non-vaccinated individuals, about how you manage shared space like bathrooms or drinking fountains or other kind of amenities that multiple individuals from different cohorts might use, about how you manage transportation or locker access, et cetera. Cleaning and sanitation matters a lot from a kind of overall sense of ease and well-being. And that's everything from kind of PPE provision to making sure that disinfectant protocols are in place. Air circulation and quality is really important to understand. And a piece of that is about the amount of fresh air, untempered air that you're moving through spaces, but also honoring the public health research that outside is really different than inside. And there's a whole set of things that we can do outdoors that just aren't possible unmasked inside. And trying to think creatively about time and space in a way that utilizes more outdoor space. We have a green book set of protocols that cover those technical pieces, and then a red book that covers kind of what happens when a student tests positive. From a technical piece, it's easy to create procedures that live on the shelf. It's a challenge to make sure that every educator, social worker, dean, operations team member not only understands what the protocols are and feels a sense of ownership and mastery of them, but can communicate them effectively to anxious scholars, to students that need expectations reset, or to families that might need clarity or might disagree. This ultimately, it doesn't make a bit of difference to have a really strict masking policy on the shelf. The question of how you have masking culture live as an integral part of strong teaching and learning is deeply important. And then, I've heard about quarantine being profoundly disruptive, and just want to quickly read from the new CDC guidance, which says that the close contact definition, which it's given, excludes students who were within 3 feet of an infected student if both the infected and the exposed student correctly and consistently wore well-fitting masks for the entire time. And so that's been a sea change for us. We have had to adjust our technical protocols to kind of uneven vaccination, but also to this understanding that if proper protection is in place, then CDC guidance doesn't set the expectation that quarantine is the result of a positive test. And that's a shift that I don't think has fully worked through reopening plans across the country yet. And it's one that, as we have thousands of quarantines, that there's going to be, I predict over the next kind of 3 to 4 months, a lot of recalibration about what it means to address positive cases this fall versus last winter.
Yeah. So Eric, you hit on something that I want to ask the whole group about. You hit on something around if someone tests positive. So I would love to hear you guys kind of popcorn or jump in and talk about what's your district protocol if a student, and not only student, staff member who has been in your building comes up, tests positive for COVID. What are your protocols? How are you dealing with that? Anyone can go first. I know you're all trying to figure that out. All right, I'm gonna call on somebody. Suzanne, go ahead.
Well, in our state, there is guidance from the Alabama Department of Public Health as far as guidance regarding quarantine and all of that from 10 to 14 days. So we don't have any in-house testing on school campuses of anything of that nature. So the individuals that are testing positive, we certainly want them to communicate that back to us. Again, that data is logged for record keeping purposes in order for us to have a clear and concise number of positive cases. And, instructionally, we have asked our teachers for students that are out due to COVID purposes to post at least 2 weeks of assignments on their Google Classroom. So during that time, students can access those assignments and be able to keep in touch and communicate with their teachers. For staff members, we certainly are staying in touch with them carefully and providing support with quality substitutes and supports in their local classroom. That, however, is somewhat of an issue right now in our district, is finding substitutes that are willing to come. We are considering incentivizing our current substitute pay schedule, raising that in order to attract more substitutes. Because today in one particular school, for example, it's a small school with a total of about 24 staff members, and 4 of those are now positive. So we have everything covered for the remainder of the week. But again, that was just rearranging, recalculating some existing staff in that school, because we could not find enough independent substitutes to fill those roles. So again, it's just monitoring the data, knowing when they are to come back, and providing support at the local school, whether it's their classroom or whatever position they're in, trying to find substitutes to fill those roles until they return.
Wow. So do you do the contact tracing, or does the health department does the contact?
Well, in our state, that is that is quite a mixed bag of answers right now. So in Talladega County Schools, we are assisting with contact tracing and notifying parents if we have determined that their child is a close contact. We felt like that was responsible to do that, and certainly would help in the mitigation of the spread and all of that. And that's quite overwhelming right now. We have a nurse in all 17 schools. Just this week, we have hired some additional contract nurses in areas where we're seeing more cases. And then getting that information, to parents, notifying them about their students. So the Alabama Department of Public Health is pretty much, I think, overwhelmed at this point.
Yeah.
With that whole issue of contact tracing. And honestly, you could probably poll 20 school districts in the state of Alabama, and there are different schools of thoughts about contact tracing. Some are, some aren't. And that's the decision I made here in Talladega County to continue that, even though we have been told from the Department of Public Health that we have no power to quarantine. So.
Wow.
Good
David,
Lord.
I know. David, how
Wow.
are you doing it? How are you doing it?
So Eric alluded to it. So there's changing rules about close contacts. And in order to keep our kids in school, we're trying to make it as convenient for our families, especially our low-income families, to be able to access testing so that we can abide by the new guidance of what close contacts are and who has to actually quarantine. And so we've acquired a lot of rapid antigen 15-minute COVID-19 tests and hired EMTs and other health professionals to augment our staff, to take the burden off of our principals and health office staff so that they can do their job. And we have a team managed centrally to do the contact tracing, communicate with parents, get their consent forms. There's this very complex California process that everyone has to follow, private, public, or charter. And we're doing it because we have to, but it's all in the spirit of keeping our kids in school. The thing that came up just last week is parents said, you guys are segregating kids and adults based on vaccination status. Because in California, it may be the case other places, the rules are different. If you're fully vaccinated and you're a close contact, well, you can stay in school. If you're not vaccinated, even though you have no symptoms, well, you have 14-day quarantine. And so some kids in a classroom based on vaccination status will go home. Others will have independent study or in-classroom learning. It is segregation based on vaccination choice. So I think we got to fix some things in California and stop politicking and just use common sense. But that's why our governor's up for recall. That honestly, and that's why things are changing so fast. It's really politics driving a lot of decision making.
So question, David, you said you're hiring EMTs. How are you paying for that? Like you're having to use your own personal budget to do this?
No. In our state, we have a statewide COVID relief funds, and there is also
Awesome.
some from the federal government. I think we all have that.
Awesome.
So Florida's kind of the foil of California. Rather than having a standardized hyper protective edict from the top, it is only the parent's choice. And in fact, the state legislature passed a Parent Bill of Rights to reinforce this kind of stand your ground mentality, which is typically associated with handgun usage. to be weaponized in public education. Parents have broad authority to opt out of any component of the curriculum that they choose to, because they want to exercise their parental rights to do so. That is now being applied to the public health concerns. The Department of Health, in publishing its guidance, said and referenced the Parents' Bill of Rights to say, this is what you need to do for public health, but if parents want to opt out, they can. And so in some ways, it's very much the foil of what David's had. And we, as the intermediate local control, believe that masks right now, given that our community positivity rates are in the upper 20s on many days, and 20% positivity rates are off the charts. Last year we would stay closed if it was above 5%. And we have no pediatric ICU beds in all of South Florida with an extensive healthcare system. We're not allowed to impose those without getting in trouble, and the state will begin reducing our funding according to the most recent ruling this week because of our insistence on it. So we've all got to make the right decisions, but we've got to be clear with people about what decisions we're making, why we're making them, and how they are to navigate it. The quarantine space arose when we started doing fire drills and safety drills. We have what are called Code Red drills here in the state of Florida that came about after the Marjorie Stoneman Douglas tragedy. All students need to go into a corner with 0 social distancing and hide from where a shooter could see them looking into a classroom. Well, some schools have had Code Red incidents due to community issues. There's no social distancing in those situations. And so now parents are asking, who in that class has tested positive or is being quarantined? Because I want my kid to be quarantined. Wow. So we are being innovative, and there's the League of Innovative Schools are providing a one-way audiovisual stream to any quarantined student with separate Microsoft Teams-based collaboration. So they can look into their classroom, see the periods of direct instruction while they're in quarantine, but go to a separate teacher in order to get assistance on those assignments and curriculum. And that's the kind of, audible we're calling at the line, to use a football analogy, in order to adjust.
Wow. How are you doing it, Eric, at Brooklyn Lab?
I don't know what's gonna get to the breakthrough of taking a public health approach that also acknowledges the real risk of kind of teaching loss and schooling loss, because kind of calling not being an in-person school for 18 months learning loss is kind of misidentifying what the challenge is. I am the dad of a 6-year-old and a 3-year-old, both of whom are attending 5 days a week in person, and it matters tremendously to our family that they have that option, right? I couldn't hold my job, with all the family support, with all of the other care support, without school there to be a kind of cornerstone of my own children's life. And we need to get to kind of reasonability with vaccination and with masking, but also on the flip side, kind of, over the top quarantine approaches that don't acknowledge how important it is for young people to be in school if they were properly protected. There's more quarantining happening today than should be, and far less masking. There is, kind of a lot of kind of argument that's being mobilized in ways that just don't make any sense to me. So again and again, with vaccination conversations and masking conversations, I hear kind of opponents of masking raise the idea that students with disabilities kind of might not kind of work with a mask, and therefore masking's not okay. we need to have a lens on the most vulnerable student populations
Yeah.
and the most medically fragile amongst us, that functionally says, because we care about the least among us, because we're concerned about the well-being of the most vulnerable amongst us, the rest of us are wearing masks. The rest of us are kind of getting vaccinated, because there may well be somebody who, for a medical reason or a religious reason, can't get vaccinated, and they deserve to be protected too. There may well be someone for whom a mask isn't the right fit, and they deserve to be protected too. And that places an obligation on the rest of us to make sure that we're kind of doing the blocking and tackling stuff in order to have everybody back in school without quarantines disrupting that continuity. So I'm, a proud member of the Educating All Learners Alliance, which is a group that is looking at how do we meet the needs of students with disabilities in this moment. And I think that unless we take vaccination and masking seriously, it's going to be really, and get to a more reasonable place around quarantining. It's going to be hard to have the stability that young people deserve.
Wow, thank you, thank you. All right, so I invite our audience, please, audience, if you have any questions for any of our panelists, please utilize the Q&A option on the bottom of the Zoom screen. Drop your questions in there and we will get them to our panelists. I will moderate those for you. My last question for you, and we can kind of do this in a rapid fire kind of 1 minute response. I know some of you may not can do this, so tell me that too. What will be the triggers for school closing again in your district? Knock on wood, we hope not, but what will be the triggers this fall after you have opened up schools? Like any triggers that you're considering or concerning? We can start with you, Susanna. So you have your hand up. Go ahead.
I think in our state and certainly in Talladega County schools, just monitoring the data and an uptick in positive cases would be the obvious. However, in our state, we're all looking for that magic number. Is it 10%? Is it 15% of the student population? I think we have to look at school specifics too. I don't want to close an entire district down if 5 schools over here, have very low cases. So as we did things, system-wide in the past, it's more school specific now and making decisions based on that particular school. But definitely when you have positive cases impacting staff and you cannot find the appropriate substitutes to fill in, that certainly will help make the decision. And then just the overall data that showcases, an uptick in positive cases for both students and staff members.
Eric, what are triggers for you if you guys need to close again?
Yeah. So we quarantine a student and kind of others who are impacted if that student tests positive. We work closely with the New York City Department of Health. And if they decided that community spread was kind of dangerous enough at a particular moment that a range of institutions needed to close, we would take their lead. There's nothing that we would do as a school system to close down schools. And a big part of that is our parents, our bus drivers, and nurses. They work keeping hospitals clean and they work keeping supermarkets going. And it is critical that we support our families by having a safe and healthy place for their children to be during the day, so that the essential workers who kind of make up our school community have the ability to serve the wider city. And so I certainly hope that things don't get dark enough again, that we're looking at the kind of widespread closure that we experienced, for, kind of in the immediate aftermath of the introduction of COVID. I think that keeping schools open is as important as keeping hospitals open, and that people rely on public schools as institutions that are full partners in making sure that young people are okay.
Yeah, great. David, what are your triggers?
Amen to that. Yeah, same reason why we opened in April of 2020 after closing in March of 2020. Schools are essential. And it's the safest place for kids. I don't see any COVID-related reason why we would close our schools. We're subject to wildfires. That would be a reason, and has been a reason in the past that we've had to close for safety and to allow for our firefighters and first responders access to the streets and to places of haven. That's it. I think losing power when we have 110 degrees outside, that's another reason we close our schools, but not anything related to COVID.
Awesome. Dan, how are you guys doing?
I don't see any pandemic-related issues coming that would close us. However, given the incredible rate of spread we are seeing within our employee groups, it is, and we are now having to put in place plans for staged closings. We already have schools where no custodial staff are able to come to work because of positive infections, to redeploy staff. If the rate of spread continues at the rate where it is, we may not have sufficient adults to run the schools. That's an internal pandemic reality, not an external. But we're doing everything we can to maintain the essential services of schools in it, both in their educational and in their social function.
Yeah, okay, great. So we have a few questions coming in, and feel free, anyone, to answer these questions, popcorn in. First question is, how are you dealing with outside vendors, companies that work with your schools, I guess having to come in and do work? Do these people follow the same protocols as your students and staff? And are they allowed in the building? And have you had to cut any of these programs? So how are you dealing with outside vendors, anyone?
So what I'll say is that right now we're open for business. They all do need to be masked. They need to meet the standard safety protocols, that anyone else is going to be. We do not have a mask exception for adults. Our only mask exceptions deal with students.
Gotcha. Go ahead, David.
Yeah, we're at the same place, same as Daniel.
Yeah. Great. Next question. Oh, go ahead, Eric.
I just think it's important for big public school systems to use our economic power, including as employers, including as entities that contract with custodial providers and, maintenance companies, et cetera, to promote health and safety and well-being in the wider community. Because, as Dan has just shared, if the wider community is sick, we can't maintain continuity of services. And so, we build it into contracts, we build it into employer expectations, not because we want to be capricious, but because we know that stability of operations hinges on health and safety.
Yes, 100%. Next question we have is, what is being done to ensure teachers are in good mental health space and lowering anxiety? What are you guys doing to support your teachers mentally?
We do a lot of team building and meals and convenings. One of the things though we did early on was we had our teachers and staff come back to school in April of 2020, everybody, because in order to open for free childcare for essential workers, we need to use all spaces. I think getting all the employees back outside and in the classroom space early in the pandemic was really helpful to help them feel that it's not scary. So we brought them to come pick up supplies, to come clean your classroom, to come do things. We gave them badges to travel saying you are an essential worker. If any law enforcement stops you, please call the superintendent. I don't know if we had the authority to do that. We did it anyways, but people felt privileged. We get to go. And then last week we had our welcome back to school breakfast with 2,500 people, all in a sanctuary at a big mega church. And we created an overflow area with socially distanced spaces saying, if you want to sit in there with a mask, that's fine. If you just want to come to the breakfast and eat outside with us and then listen from outside, that's fine too, but work happens in person and let's go. And by the time the breakfast was over, just about everyone other than 2 or 3 people were inside enjoying the program and convening. And I think that the more normalcy we can create, I think that will be the best for health, safety, and well-being.
Yeah, each year we have what we call Institute, and all employees, we have about 1,000 employees. They all come together in one location where we just honor leaders to learn from, is what we call these individuals who have been selected for their outstanding work in our schools. We usually have 10 to 15 of those that we honor. And then I give a message. And this year, it was strictly entertainment for our entire staff, certified and support staff. We had a local entertainer who we raised the money to come and entertain all of our employees because we wanted it just to be a time of joy and an uplifting experience, not to listen, to me talk about learning loss or whatever. I talk enough about that, but we just wanted to have it was an hour and a half together, and we just wanted to be able to celebrate a new year, to welcome everyone back, because last year we had to do our institute virtually, and that wasn't half as fun or half as effective. So lots of things are going on just in our local schools with different initiatives to support teachers. We do also have a person in my office who works with both students, families, and employees with issues regarding mental health. And I rarely see him because he's always in our schools. If I see him, I'm going to see him in a school. And I love that because he's there caring and taking care of our folks. And that's something our state has done a better job, is the addition of funds to help support mental health. So that's been welcomed, funding for that. But, we need about 5 of Mr. Lavender to be able to really cover all 17 schools and 1,000 employees. But definitely he covers a lot of ground and is making a big difference in the supporting, measures that he is offering to families and employees and students.
Awesome. Anyone else want to share how they're doing it with?
I'll just say we have a big mindfulness initiative that has proven prescient to the pandemic. Former Superintendent Runcie and I had launched it right before the MSD tragedy that we had here, but it and the trauma from that experience informed a lot of how we were able to make sure that we're taking care of our caregivers.
Awesome. Awesome. Well, I would love to thank our panel. I think you shared a wealth of knowledge with us. David Mishiru, thank you. Eric Tucker, thank you. Dan Gould, thank you. Suzanne Lacey, thank you so much for this opportunity. Before we leave, would love to now turn it over to Lisa Jobson, who is the project director at Digital Promise Global, to share an opportunity about the Sienna Challenge with us. So Lisa, take it away.
Great. Thanks so much, Dwayne. I'm really happy to be here today. Just to say a few quick words about a new global design challenge that we're launching next month. The Sienna Solutions Challenge supports middle and high school students all over the world to design solutions for issues they care about in their communities. So we're inviting participants to create anything from digital campaigns to apps to podcasts or something else that leverages everyday tools and technologies for positive impact. The call for submissions will open September 15th and run through January 10th. And as part of this, we're also inviting educators to apply for $2,500 sustainability awards to support student projects. So if you're interested, siennachallenge.org, hashtag Sienna Challenge, or feel free to email me at lisa@digitalpromise.org to learn more. Thanks, Dwayne.
Great. Thank you so much, Lisa. If you guys would love to take advantage of this opportunity, feel free to sign up. Lisa, do they have to be a member of the League of Innovative Schools to sign up?
No, and they can be anywhere in the world.
Yes. So please, if this is of interest to you, please reach out to Lisa. We'll be happy to support the work that you're doing. Thank you, Lisa, once again. All right. Thank you once again to the panelists. Thank you to all of the great work. Next slide, Jessica. We would like to remind you that this is a series. We had our kickoff today on September 1st. Please join us for equity and access conversation we will have with a few district leaders. On September 8th, family and community engagement. September 15th, data privacy and data equity. And last but not least, September 22nd, we'll have a conversation around teaching, learning, and assessments. If you would like to register for any of these sessions, please go to the link on the screen is bit.ly/reopen-strong, or you can also watch our recordings of all of these sessions on our YouTube channel. Once again, thank you for joining us, and we look forward to seeing you next week.